Okay, it's 10:30. We're back from recess. This is group 2 of our budget hearings for 2025's budget year. Jennifer, I'm going to turn it over to you first.
Yes. Jennifer Sauer, Financial Administrator. This is our health and our health section of our budget. We will have the health department and various of our community partners that we assist through allocations in the budget. So
Okay.
We will get started.
Good morning, Commissioners. Teresa Fisher. I'm the Director of the Shawnee County Health Department, and I am pleased to be able to present our 2025 budget request to you today. This budget, much like last year, was prepared with our leadership team and our accountant who are in attendance today. Should we have any specific content questions I can't answer. Last year, we really changed how we did our budget process and taking a deeper dive. And we used that same process this year, but just really refined it some more with our new finance division manager on board, looking at expenses line item by line item, looking at revenues, looking at our strategic plan and what our anticipated needs would be. So we feel like to date, this is the best budget that we could put together. I always like to just do a meet the team. So in the health department, we have approximately 65 FTEs across multiple programs for different divisions. So our opening slide had our vision and our mission, and these are the individuals that every day come to work and live that vision and mission and working on making our community a better place for all of our citizens. All right, so the meat of our presentation is about our budget. So looking at 24's adopted budget, which was $3,071,435, we are asking for an overall increase this year of 6%. That increase totals $196,684. Which would take our new budget request to $3,268,119. I'm going to take a deeper dive into specifically what makes up that increase over the next few slides. However, I want to make a couple of notes before we begin. We do have 2 remaining COVID grants that we received during the pandemic that are rolling off this year. So those grants have still been a part of our 24 budget that you would have heard last year. We have a supplement to our immunization action plan budget, and then we also had an infrastructure grant. And so one of those just literally rolled off yesterday, and one will be rolling off at the end of this month. So with that said, those grants are 100% done and will not be on our budget next year. And those were one-time grants, so we're not eligible to reapply for those. The other item to note is our aid to local grants. When we put this budget together, our aid to local grants were still in their application phase. Of course, I brought those grants to you all to review, to look at. Next week, I think I'll be able to bring back our award letters, but we did not have those award letters when we drafted this budget. And so for my team, it's really challenging working with the state fiscal year, the federal fiscal year, and then the county fiscal year, and trying to align all of those grants and making sure we have enough to cover all those different program areas and what the grants cover and what they don't cover. So again, a lot of kudos to them. The other item I want to note is you will not hear any CIP items on my presentation today. I did note that Nelda with facilities had several of our items that she and I have discussed and done some walkthroughs in our building, and really all of those CIP items fell under facilities. So that's why they fell under her department. All right, this slide I won't spend a lot of time on. We broke up our line items as far as increases. So these are 3 line items that were over that 3% increase up to 25%, but very small dollar amounts, as you'll see. And if you have specific questions on any of our line items, I'm happy to go into those. We did look at line items from a department perspective. So when we build our budget, we build it not only by division, but then we also build it program by program. So when we look at these line items, we're looking at our whole department across the board. So all of these line items had over a 25% increase. Again, some of them though are smaller ticket items as far as dollar amounts, even though they were a higher percentage. The 4 highlighted items are what we're going to really dive into and give some rationale and explanation behind the increase in those. So those 4 line items across the board are contractual services, immunizations and pharmaceuticals, lab and x-ray, and equipment leases. All right, we'll start with contractual services. So this year we have put about $16,500 into this line item in our department. We are asking for an increase of $23,413 for our total to be just under $40,000 for next year. The largest item that we are asking for in the contractual services is we would like to enter into an agreement with Livewell Shawnee County to help cover some of the cost of the director. Livewell Shawnee County was formerly known as Heartland Healthy Neighborhoods and has rebranded into Livewell Shawnee County. Most of us have been around long enough to know what it was like before we had a director with that coalition, and everybody doing the volunteer pieces. And so since that director position has been established, we've really seen an increase in the amount of work that group has been able to do with being able to have the reporting mechanisms and just making sure that the work is being carried forward. With this, what we did is look at really our community health planner position that we had eliminated from our budget for this year, and found that a lot of those duties really realigned or aligned specifically with the CHA and the CHIP work and that steering committee. This particular person is responsible for developing and implementing the work plans to address goals set by that steering committee. They research the objectives, they research the strategies. Sometimes they need to have subsequent recommendations. And then the reporting. The reporting is huge. So they would be reporting monthly, quarterly, and then annually to that steering committee. In looking at counties across the state, we would be joining other counties, including Douglas, Johnson, Wyandotte, and Allen County, among others, that have made a significant investment in their local coalition. They've been able to already show tremendous returns on investments through those through their investing in their local health coalition. Again, this really expands the public health capacity in that CHA and CHIP work. We feel like this is our opportunity for Shawnee County to invest in our local Livewell coalition. The contract would be for $20,000 per year. We would be looking at a 3-year agreement. The 3-year agreement was built out of the idea of that CHA and CHIP cycle, and that would get us through an entire CHA and CHIP cycle of 3 years. The amount is equal to 34% of the director's salary and benefits and 19% of the total Livewell Shawnee County operating budget this year. This is something that we have a history of previously doing. Most recently, we entered into an agreement with Vallejo and funded a community health or a health promotion specialist that works specifically on working on the CHIP with the mental health deliverables. And at that time, that was funded at $50,000 a year. So we're asking for substantially less than that. Our next line item is immunization and pharmaceuticals. This is our largest single line item request. This year we've got just over $200,000 in this line item. We are requesting an increase of over $200,000 to really double this. This was really with a further analysis of looking at this line item and what the immunization and pharmaceuticals are costing our department to purchase. And so there's a simple answer that these rise every year. We might buy things at the beginning of the year, and by the midpoint of the year or even the end of the year, there might be an increase. We have been able to handle this over the last year, I would say, or the last couple of years, but in order to have a true budget, we have been overspent in this line item significantly over the past several years. And so this is a true reflection of where we're at, and we feel like we would need to be. We have, there are new vaccines that we need to add on. Most notably was our COVID vaccine that we wanted to carry. Carrie Delfs, our division manager, does a great job of looking at what we're required to carry. There are some requirements with being a Vaccines for Children provider that we have to carry the private vaccines that equal that. But her and her team do a good job of, I think, keeping an adequate stock, but not an overabundance of stock. But the truth is, vaccines and other pharmaceuticals just cost. They really do. We're going to talk more about revenues here in a minute, but I do want to note that so far we've already brought in 73% of our budgeted revenue in our immunizations program again, or this year through May, and so we feel like if we're able to keep that pace, we would be able to cover this increase in requests that we're asking for. Our lab and x-ray is another line item that has increased. This year we had $2,000 specific for that. We're asking for an additional $12,000. The items that are included in this are some of our family planning testing, our PAPs, our QFTs, which is for tuberculosis, rabies testing, state labs, and other labs. And really, these are just things that are not specifically covered by a grant. They're things that we are needing to cover for our patients that are otherwise not able to afford this. We do try to recoup the amount that we're able to, either through patient pay or our insurance billing. But this is an increase and more factual as to what we're covering in this line item. And then our last area specifically is our equipment leases. We are asking for an increase of just about $25,000. This year we've got just under $27,000 for this. Most notably, we are looking at 2 vehicle replacement options for this. These vehicles are for our environmental health staff. We have a crew of 4 that are out and about in all types of terrain. And currently we've got 1 vehicle that is about 13 years old with about 200,000 miles, and it's just nearing its life mechanically with needing a replacement. And then we do have a smaller SUV that is in great condition, but it's not exactly suited to the terrain. That individual has actually been high-centered a couple of times, and so we would be looking at another pickup for that person. And then what we would like to do with that smaller SUV is actually repurpose it to our clinical services division. They currently have a hand-me-down from the appraiser's office. It's an older model Ford Focus. Mechanically, we've had to put some dollars into that just to keep it running and make sure that staff get from point A to point B. That's a vehicle that staff use for the direct observed therapy for our TB patients, could be on a daily basis depending on how many we have, and then also to travel to our vaccine clinics. And so sometimes it's a challenge getting the vaccine coolers and all the equipment fit in there, and so being able to shuffle that SUV over there. We currently own that SUV. That was an SUV that was purchased, but we feel like that would be really meeting the needs of both of those programs if we were able to get 2 additional leases. I put in the revenue analysis and trend. I think this is an important slide to note for our department. We are a department that does bring in revenue through either largely insurance but also patient pay. And so we have gotten our books cleared out through May, if you will. And so right now you'll note the blue line is our actuals and the yellow line is where we have budgeted this year. So this is in large part due to our billing department. We've really revamped that. We've got several new staff, really all new staff in the billing department and in our finance area with our division manager, really doing due diligence and learning our billing software through our EMR and tackling some of those challenges. So right now we are looking well ahead of where we should be for most of the months, and then this is forecasted out that should we keep on this pace, that we would have an additional $280,000 that we didn't have budgeted initially for our revenue this year. Immunizations is by far our largest program that brings in revenue, but we do have a multitude of other programs that bring in revenue for the county. So we are looking at fee schedules. We've briefly discussed those, and more information will be coming with that. Looking at just the long overdue needed fee schedules in a variety of our areas, and really trying to get some things set in place so that hopefully we become a little bit more profitable, but also just increasing our contribution to the county where we're able to. And the last slide here is just a basic pie chart. As most departments, most of our budget is spent on salary and benefits, which is 73%, and then the other 27% is made up with our operating expenses. That concludes my presentation. What kind of questions may I answer for you?
Commissioners?
So the vehicles that you talked about, were you looking at buying new vehicles or
We would be looking at leasing.
leasing? Okay,
Yes.
that's my question. And then under immunization, I noticed in here you said at one point KDHE was paying for some medical supplies, and they're no longer doing that. Is that something they cut off recently in the last
Yes, I think largely, and Carrie can correct me if I'm wrong, but I believe during the pandemic, there were some supplies that had been covered for various reasons. And as that funding runs out at the state, they're no longer able to pass that on to the local health departments.
Yeah. All right. That's all I had.
Commissioner Mays?
Nothing right now.
Okay. Just a follow-up on those trucks, those are for the environmental health when they're going out in the field, which is why trucks are needed.
Correct.
The Heartland Healthy Neighborhoods Now Live Well, that 34%, who makes up the other percents?
I might have to ask Craig Barnes, who's part of the steering committee, to answer that question.
Morning, Commissioners. Craig Barnes, Shawnee County Health Department. That is still up for discussion right now. United Way, who operates as the fiscal agent, is taking on a lot of those operational expenses to cover the, especially the benefits related to the director of Live Well. The Pathways grant that we had received through Blue Cross Blue Shield was covering those in its entirety, but that grant is coming to an end. And so that's where we're looking at sustainability for this position in the long run to ensure that the kind of the direction that we have had over and the momentum doesn't cease over the next couple of years.
I didn't know if this was something that the city of Topeka was already committed to picking up, because it would seem if the city was picking up a third, the county was picking up a third as a partnership, but I didn't know if the city had been approached.
There is some funding coming through the Metropolitan Topeka Planning Organization. I can't tell you off the top of my head, but I would be more than happy to get you those numbers as soon as possible.
Okay. All right, thank you.
Mm-hmm.
Teresa, could I ask you a question about those
Yes.
leases, if you don't mind? So were you looking at that costing $21,000 for both of them together for leasing them, or is that just the cost of the vehicles?
No, that slide, let me.
Sorry, I know, I'm
That's
going
okay.
back a couple.
Oh, here we go. So no, that would be a combined cost for both of those vehicles per year.
Okay. Have you gotten estimates from Enterprise for that?
These are their estimates.
Okay. That's higher than most of our other leases have been, is why I'm asking. I think right now they're looking at about $6,000-7,000 a year for a F-150, or actually for a Tahoe last year. A loaded up Tahoe was about $6,000.
Okay. I can definitely, that was our
Yeah.
contact with Enterprise, and they were definitely more than what I expected also.
Prices are volatile, so that's fine.
All right, any other questions? All right, thank you, Teresa.
Okay, thank you.
Thank you.
Helping Hands, you're up next.
Catherine Maxwell with Helping Hands Humane Society. For 2025, the shelter is requesting $148,344 to admit the stray and unwanted animals, specifically the pets, dogs and cats. And that number is coming based off of the projected number of animals to come in 2025 from the county, which is 1,071, and you can see that breakdown down below for where that cost is generated. We are also requesting an update to our county court hold fees. These are the court hold fees, actually, that would be for the county, the city, the state, and anyone else who requests that service of us. These include veterinary fees should the county want us to do the medical work on any of the animals that come in, for the court hold dogs and cats. But otherwise, it's pretty standard from every year. If you have any questions, I'm happy to answer them.
Any questions regarding Helping Hands? No? All right, thank you.
Thank you.
Community Resources, CRC.
Good morning, gentlemen. I have new paperwork saying that you have, but just in case, you don't have to dig it out.
Thank you.
Old school, I love paper. Can't help myself.
Thank you.
Thanks. morning, Commissioners. Mary Thomas, Community Resources Council. We ask for the same contracts to manage what we do for the city in this form of social service giving as we have for the last several years. So moving to spreadsheets, that's where the real meat is. Let's look at social service funding for 2025. Committee worked hard here. The requests that came in were 41% over last year. Through presentations and review of budgets and a lot of sweating, they got it down to 16%. They're hoping that that's something you can support. We had a few new agencies apply for the first time. The committee felt they didn't want to turn anyone away, but there were a few haircuts taken just to try and give some support in appreciation of the grassroots effort that was being worked in various agencies. Some of these were a couple years running, some of them were brand new. But their presentation was such and their support within the community was enough that they felt they wanted to go forward with at least a stipend to see if they couldn't make things pull together. And then hoping to look at them next year with harder questions on results, outcomes, and unduplicated counts. And before I go to questions there, we'll just look at the other spreadsheet, the lion's share of the money, which is the Advocacy Council on Aging, all programs regarding senior programming. Most of the same players here, no new agencies requesting funding. However, many of them are growing. All 5 of the senior service programs within Shawnee County have stepped up. They're a little more robust in their programming. All but Rossville and Silver Lake are running full-time. Both with Rossville and Silver Lake, they have added hours. They've also added some depth. We're very pleased to see Rossville come back. I have worked with them personally for the last year to sort of guide them through fundraising and some different opportunities to show that they're going to earn their way along with help from the county. We really want to have a presence there for the seniors in that part of the community. As you can see, the initial requests were at 8% over last year's budget, and the committee worked that down to 4% over last year's budget. Again, hoping that you would find a way to support that. Everyone here is doing good work. Presentations were robust. Committee had a lot of questions, and they seem to be doing very good work for the seniors in our community. Beyond that, I'll stand for questions.
Questions?
Midland Care, they're new this year.
Well, they've gone through a name change, but it's Meals on Wheels
Oh, okay.
all day long.
All right.
I think they're working on some branding.
And they had not requested any money in the past.
This was a new program. It's a one-time shot. It's something very specific in training that they need. It's really kind of a train-the-trainer type of event. All of their agencies will use it, and it's a state-of-the-art dummy that's going to teach them to do everything with responses back from this dummy, if you will. But it's everything from starting the heart again to doing IV work to doing a tracheotomy. It was very expensive, and that's what they've come forward to ask for, just that item. And then they will train throughout their, across lines of all their staff for this, at whatever level training is required. And it will last them several years.
Okay. There's another one on here that I had not heard of before, Hearts.
Yes,
For the-
that is a new agency. It is grassroots. It's been about 4 years in growing. It is all volunteer board, and it working specifically with youth. And I don't want to use the term, but those that are not in mainstream that often struggle and are working through suicidal problems. That's not to say that they're not working with Vallejo or Family Service and Guidance Center, but this is also to try and reach them where they're at on the street with skills and a support. So they're new, but again, it's been 4 years growing, and they seem to have a support and network group of parents and other community providers. So the community wanted to give them a little shot for they had some events they want to do in '25. They wanted to support that and see where it goes.
Thank you.
Well, I noticed Habitat for Humanity took quite a jump.
Yep.
You know what spurred that on?
You know, they are the agency I use as the poster child on how this really works. They take this, what I call cornerstone money from the county, and you can see how it has grown every year. That's why I give you several years of a look back. And they then probably 4 to 6 times over multiply that money through other gifts and donations and grants, but using the county support as their base to go forward for match funds, if you will. They have grown this program in keeping seniors in their home far and away faster than I ever thought it would, and of course for Janice as well. They have a wait list. It never ends. Sometimes it shortens, but trying to do the work that seniors need in a grant opportunity as opposed to a loan from the city that ends up being a lien on their house, not to degrade that program, but it's a whole different ballgame there. But when you can fix a roof, when you can fix gutters, when you can fix windows, when you can stop rainwater coming in, so then we don't have mold and all the things that go with it because they can't keep up with that. A simple leaking gutters in the right place over time will displace an elderly couple or an individual out of their home because they can't pay to do the repairs that have now multiplied 5 times over. This is what that program does, and it's amazing.
I also noticed LULAC had quite a jump.
LULAC has programs that the other senior agencies pale in comparison to, and it's kind of where they're at. It's also their cultural support. It's also the support of other businesses and foundations within the community, and they run full staff and full count every day, so that they are now moving within the community for different opportunities, like they have Tai Chi and exercise. They move out into other areas within the neighborhood so that they have room to do these kinds of programs that the seniors request. So they're busy. They also have requests. They have a wait list. They have requests from all over the county to be picked up, brought to their center for some of the programming that they have that they can't find at the other centers. And I think that's where some of this expense is going.
Other questions? All right, thank you very much.
Thank you, gentlemen. Have a good day.
All right. Health Access, you're up.
I'm sure you guys appreciate her larger spreadsheet.
Thank you.
Thank you. Thanks.
Good morning, I'm Megan Skaggs with the Shawnee County Medical Society Health Access Program. Since 2002, we have continued to have our goals remain the same, providing access to over 18,000 unduplicated low-income uninsured residents of Shawnee County. We help coordinate donated health care and prescription assistance for those low-income uninsured residents. Just as a reminder, in order to qualify for our program, residents must live in Shawnee County, live with under 150% of the federal poverty guidelines, and then they also must have a primary care provider within Shawnee County that works with our program. If patients don't have a primary care provider, we do work with them to get established somewhere. Patients enroll in our program for 6 months at a time. We do screen their financials every 6 months to ensure that they maintain qualification for our program. And we average assisting about 1,500 patients each month, recording over $273 million of donated care over the past 22 years. Let's see. We are requesting prescription assistance from the county as we have done in years before. However, this year we are asking for a reduction in assistance. Previously, the last several years, we've asked for $110,000 for assistance, and this year we are only requesting $100,000. A big portion for that reason is the success of the 340B program over at Grace Med. That is a pharmacy that is federally funded for Grace Med patients who are uninsured. And they are able to help patients with prescriptions at lower copays than what we have with our health access program. And so a lot of our patients are getting their prescriptions through the Grace Med pharmacy, which is why that we have seen a reduction in our need for prescription assistance. When patients are enrolled in our program, they have, their copays are $5. They are able to work with pharmacies in Shawnee County that do not charge us a dispensing fee, and so we are able to keep our cost fairly low. We have about 45,000 of prescription claims each year that we help fund, and so our dollar stretches very far for the assistance that we have. The City of Topeka also helps fund this prescription program, and in 2025, we are set to receive just under $50,000 in assistance from the city as well for our prescription program. Prescriptions help keep people out of the emergency room. We report about 91% of our patients report to us that they have not been in the emergency room in the previous 6 months once they are enrolled in Health Access. And so I'm here to thank you for the assistance that you've provided to us over the years. And if you have any questions, I'm available now.
Questions? No. All right. Thank you, Megan.
Okay, thank you.
Extension, you're up.
Good morning, Commissioners. Candace Stiles, Shawnee County Extension Office. And with me today is our Financial Office Professional, Joanne Domi, and our Board Chair, Sherry Scheidemann. I want to start by thanking the Commission for your support of our research-based programs and education for Shawnee County residents. My presentation is going to be shorter than normal because you all have been letting departments come on these Monday morning work sessions to report to you. We have been doing that quarterly, so I'm not going to repeat all that information that you've already received. But I do want to thank you for that time because it is the envy of some of my urban counterparts who do not get that opportunity to communicate with their commissioners. So just so you know, we really like those Monday work sessions. As you know from our budget request, we are asking for a 2.85% increase to our appropriation. This increase is to keep our office running at the same staff level and with the same programs as we do now, so kind of a neutral operation type of increase. The majority of the increase is going to our benefits line. Our employer contributions for CAPERS and health insurance are rising, about 4.8% for both. And we also are fully staffed, which is great. I know a lot of departments have problems with that, but it does put a strain on our benefits line. The funding for our office is a partnership, and K-State has increased funding for agents, FNEP staff, and SNAP-Ed staff. So we're very thankful that they are doing that part. They did a 2% increase, but that's on what they pay, and our support staff is fully county funded. And then I can't forget all the help our office receives from volunteers for our programs. Since our last budget hearing, they have donated 13,906 hours of time, or 6.5 full-time equivalents. We couldn't offer 4-H, Master Gardeners, VITA without this volunteer support. And then I'd be happy to answer any questions you have for us about our request.
Questions for Candace? All right. Thank you very much, Candace.
Thank you.
Vallejo, you're up. And I guess mental health, not just Vallejo.
Thank you, Chair, Commissioners, and Jennifer's office. We appreciate the time. I am joined this morning by several guests, and I think I've got everybody out there. One of our governing board members, Renee Franklin, and then Brian Blevins from Breakthrough House, Topeka, and Kathy Mosier from Family Service and Guidance Center. I figure we have about 10 minutes total, so I'll take about 9. No, let me just, I like the way the last presentation went. You know, we've been in here about every quarter. You know what we do. I think you have a good feel and appreciation for the partnership that we have here. And so I'll just refer you basically to the first page and a half that describes who we are, some of the issues that we're facing with our partners. Would like to speak very positively about Live Well and the work that they do. It's an essential connection for us with the data, the partnerships, you know, the view out to the future. And so I just, you know, if I could just candidly offer that recommendation on Live Well. We really count on them for a lot of things. And they do have a mental health collaborative and a substance use collaborative as a subgroup. They're also very helpful for us in planning, budgeting, finding out where the unmet needs are in the community. It's an essential contact for us. In the middle of page 2, we refer you to meeting unmet needs, which is always what we try to do with our county dollars. And just will point out on the Vallejo piece, that second paragraph, it's about the 6th paragraph down. I have a number of projects going that you know, we're trying to move ahead on, progress in some, and doing fairly well, trying to, you know, use multiple sources of funding to advance that, including any county funding that might be available for the future. And we are, as a group, asking for a rather large increase, about 33% laid out there on the last page. We landed on a round number of $3 million for county funding. Counties are allowed, I believe, to put in about 2 mills of property tax total, although other ad valorem, although other funds can be used. So we do lay out some initiatives there, mainly for Vallejo along the public service lines, visiting, you know, about services we can increase in the jail, work we do on competency to stand trial, including restorations to competency, hopefully save some trips to the state hospital for that kind of work. I just refer you there real quickly. And then we have a look forward, talk about some outcomes, look forward, and then laid out on the last page for your viewing would be the request for calendar 2025. With that, I'll pause for questions or cede my time to my colleagues.
Questions for Bill? All right.
No.
None right now.
Thank you, Commissioners.
Okay.
Thank you, Jennifer.
Good morning, Commissioners. Kathy Mosier, Family Service and Guidance Center. You have our annual report. I will just refer you to a couple of things. One of our outcomes in school-based mental health. So we have a very much an increased need since COVID of youth struggling and their families and all the members of their families. And so to look at our, you know, we had great outcomes to report last year, but in 2023, it even soared further. So on page 5, there's a little blue box on the bottom, and it says improve school attendance for those who are having that issue that worked in our programs. This is where we catch people who may not be, where we hear from our community needs assessment and from our community partners that there's a need out there that's not getting to us. And so going outside our 4 walls into the schools and letting the schools help identify families that might be in need, and this might be a way to help them access services where otherwise they may not have had transportation or weren't able to get to us. So school attendance increased by 85% with that program. Our academic performance for those kids, 77%. So more kids are staying in school, they're not dropping out and having expenses increase in other areas of the county. And then for behavioral write-ups in schools, 72% increase. These are an increase from even last year. And the internalizing behaviors is new the last 2 years. These are the ones who are socially isolated, who are not necessarily causing trouble in school, but are not going anywhere and end up being either maybe cutting themselves or depressed or having anxiety issues that prevent them from being part of society fully. And those, we're making a lot of headways in those departments as well, which is allowing them to be more successful and follow their dreams in life. The next place I will refer you is just to the page about what people are saying about us. Some of the quotes from different folks we see. And this is kind of coming off, letting you know that there is a federal grant that has been helping us meet the excess needs since COVID, with some salaries and things to try to meet that need, and that is rolled off now, and so we will not have that in our next budget year. That was about $4 million. And so then we have also the work that we're doing for new programs. We have started a supported employment, has been around for a long time for adults, but now we have supported employment for youth and transitional age youth. We have 25 people who started that program, and it just opened 4 or 5 months ago. And out of those 25, 21 of them have jobs and have held their jobs for over 3 months now, and have all kinds of great things to report about how that has helped bring meaning to their life, self-confidence. They're learning to work through how to work with others. And the last thing I'm going to show you is just to hear from one of our clients themselves, which is not something we're usually able to show. So I will end with a really short 2-minute video.
Hayden is very outgoing.
And smart, very playful.
He loves to draw. Elias is very silly, very sweet. He's a very affectionate.
Very affectionate kid. Some of their behaviors were hard to manage. They didn't really show with Hayden until their dad went to prison. I think that's something that still affects Hayden. It was a fight for who had my attention, and when they weren't able to really share that attention, it had to be both of them at the same time fighting for who was going to get it. I think it was somebody at the admissions office that told me they actually had a school-based option available, and I thought that would be better. I went to family service again when I was a kid, and I didn't like as a child getting taken out of school to go. I guess it just made me not feel isolated, but just separate from other kids. So I thought the school-based program would just fit our needs better because I'm a single parent, and I was working overnights, so I didn't have a lot of time available, especially in the evenings, to go and take the kids where they were going to be. And it was really helpful that Brandon was able to come to my house and we could do the visits there if we were doing a family session. It helped that while they were in class, one of the workers would come in and sit with them sometimes and helps them learn skills to manage their hyperactivity or just manage themselves in the classroom. Probably 4 months in, his teacher told me like how much he's grown up in the classroom, and then Elias's teacher told me how proud of him she was, how he's just excelling in the classroom. That was a pretty big realization, this has really helped and everything is really came together very well. Oh, very nice. Over the process of us working on things together with Brian and Family Service and Guidance Center, we were able to get to a point where we didn't need that outside help, that we could manage together and get along and listen a lot better. I think Brian helped me realize it's okay to walk away. It's not always a fight. When they're upset, they're able to work through it with me instead of just throwing a tantrum. We get along a lot better. Being present and actively engaging with your kids means way more to them than buying them stuff or getting them the coolest toys or any of that. Kids want their parent to be there, to play with them, to engage with them, to read to them, to have dinner with them. That's the best thing you can give them is your time.
I have to go after that. I'm Brian Blevins. I'm CEO for Breakthrough House. Last year when I was here, I told you that we would have an accredited clubhouse, and we got international accreditation a few months ago. It's hard work. It takes, we had to restructure our staff in order to get people who are educated in how to do what we need to get done. Those people cost money. And so I think that's the biggest part of what I'm looking at, is a way to afford the people that I've hired. We've got some amazing outcomes. We're looking at providing some additional supported housing. This is a program that has a lot of good science behind it as to what it provides in outcomes. And I think when we're looking at where we put our money, we have to look at what outcomes we're getting out of that money, and where the science is best well spent. And that's what we're looking at, you know, and get those numbers. What we do is as an organization, we have a payee department. I think we have the only payee department in the state that actually allows people to come to the organization to talk to representative payees. Gives us a platform to help people, you know, in crisis, because everybody wants more money than they really have, and it's really a challenge. But keeping that staffed. We also have, again, the clubhouse, and then we have 3 group homes, several apartments. We house about 39 people every month. We're looking to expand that. We have found a really good marriage between what happens in a clubhouse, which is kind of a study in interpersonal neurobiology. People just get better when you give them a good, safe, healthy environment to be in. And so we want to also provide a lot of those people with some additional good, clean, stable housing. And so our job, we feel like we hired an outreach person to work really more closely with Vallejo and Family Service Guidance Center, so that they can build that relationship. And when they find those people that they get stable, we can keep them stable in that environment and move them into a temporary employment program. This is all based off of a work order day, so they find purpose, they find meaning. You just have to come and look at it. It's amazing, it really is. I do want to take 1 minute to acknowledge Teresa and the work you do with Shawnee County Health Department. It's an amazing organization, so thank you. Questions?
Questions for Brian? Okay, no, thank you.
Thank you.
Bill, I'm going to have you pop back up just for a moment. The overall increase for mental health in Shawnee County from 2024 to 2025, it's a requested increase, I believe, of $750,000, taking us from $2,250,000 to $3 million flat. Can you talk to where would that money be going? What's the reason for that increase?
You know, I'd direct you to, good, thank you, Commissioner. 6th paragraph, I think, on page 2 outlines some of the Vallejo objectives with that money. I do want to say for the Vallejo piece, you know, you wouldn't be alone on that. You know, we work with the city, county, state, and federal government on, where we can find funds to operate these programs. The co-responder program is a good one with the city, alternative sentencing court, developing, mental health court in the future. Just a lot of initiatives there. Of course, the challenge is always serving the uninsured and people who are underinsured. Demand is up in most of our programs, and that requires, staffing costs. So just the cost of, behind a lot of those Vallejo initiatives would be the cost of staff and just trying to keep up with salaries and initiatives and just the cost of doing business. I would defer to Kathy or Brian, but would also stand for questions.
Questions for Bill?
Just general operating costs that, personnel mainly. Chairman.
Oh, come up, because make sure you're at the mic.
As an example, I think it's in our report that the donated services that we provided, $3,500,000 donated services, charitable services that were not, were not able to be supplemented. So that's kind of where that stands with us, but we don't want to stop serving people because we don't have enough funding, and so we have tried to make that happen. So we try to get grants and donations to cover that as much as possible.
Mr. Mason?
Kathy, before you sit back down, I had a question. On your presentation that you've given us, one of the bullet points on here says substance use treatment program had an increase of 363% from 2022. Is that a good thing or a bad thing?
That, well, it's mainly a good thing. So this is something that did not exist in Shawnee County, this treatment. It was needed, but didn't, so people had to go to Olathe, which is about the only other place for youth in the state. And there was not enough in the state resources for this. We had our own people in Shawnee County who were on 6-month waiting lists to get in there. And so we became alcohol drug certified or licensed and have opened our own 28, up to 28 days they can, for co-occurring crisis issues, to help them get clean and to learn healthy living and to prevent furthering the addiction. And so our new Youth in Crisis House has that available now, and that's where we've had our first entries into that. They've all been from Shawnee County. They've mostly been brought from law enforcement situations. And we also, with being our first year in, our first year to our second year, and we've only been doing this for 2 years, that's where the 320% growth comes, because it just wasn't available
Okay,
in ours. Yeah.
great. And then one question for Bill also.
sir.
I was under the impression that when we got the CCHBC accreditation, or I don't know what you call it, designation,
Yep.
that it was going to provide more money for you guys. Did that not happen?
It has, yeah, there has been an increase, and I think probably Kathy could speak to that as well. We have noticed an increase in Medicaid revenues, just not enough to keep up with the demand for care from the uninsured. You know, these folks pay 5–10% of our, you know, charges or less, and a lot of our clients, at least at Vallejo, are living on, you know, $800–900 a month, $1,200 a month, you know, way below poverty level. That's really the big driver. And then you add, you know, the initiatives that we speak about in the 6th paragraph on page 2, like assisted outpatient treatment, you know, an opportunity to, you know, keep people at home versus, you know, a trip to the state hospital, working with Judge Everts in the court on that. So, yeah, it has made a, you know, a nice increase, but just not enough to sustain the demand overall, and the cost of, you know, meeting that demand, which, again, Commissioner, mainly staff.
All right, thank you.
Mm-hmm.
Bill, anything? All right.
Chairman, Commissioners,
you.
Jennifer, thank you. Appreciate you.
Last one up for this group is the Conservation District.
Thank you. My name is Wayne Lookert. I'm a supervisor for Shawnee County Conservation District, and I'm not sure what you have in front of you. I was not able to bring extra copies today.
When we have a summary, and then we also have a budget hearing. It's titled Budget Hearing Topics 2024, and it's in the letter from the Conservation District.
Okay. I will be referencing the,
Okay.
The budget?
And then we have the Conservation District 2025 Operations Fund Budget.
okay, that's what I will be referencing. Everything. We are not requesting an increase of any additional funding for the Conservation District this year. And also just kind of want to just bring you up to date a little bit on what's going on. Last year, one of the increases was because we were in the process of hiring a new district employee. That did not work out as well as we had hoped, and so we are looking for another district employee. So anyway, we are looking at different options, but because of some of the involvement we have been doing with our state association and things over the years, and support for you guys, because of your support, we were able to do more with our state association, and they have provided more resources to us to help us get by in interim by providing part-time employees to come in either to cover at cost-free, or we would make up the difference, which we were able to do, you know, for short term. And everything the Conservation District does complies with the Clean Water Act, not just administering the cost share programs for the state, but also for education programs, putting on workshops for developers and contractors, and as well as the general public. And also, just kind of wanted to let you know our funding, we get up to 25,000 from the state, matching fundings, whatever we can squeeze out of you guys. And, but we've never gotten the full 25. They've always do a percentage across the board cuts for everybody. And every last few years, oh, this year you're getting it, this year you're getting it. And well, we're still waiting on that. But the only other thing I wanted to point out on there is down there, this from the state appropriations, there's a typo for the proposed budget for 2025. It says 34,000. That would be closer to 24. And it would just change the bottom line there from 64 to about 54,000. Is all. And other than that, I can't think of anything else unless you guys have any questions.
Nothing from me.
I'd like to introduce Francis Kelsey, one of our board members. Two of our other board members would have been here, but they're weather related, they could not make it. And the fifth one is on jury duty.
So they're here.
Yeah.
Sort of.
Questions? As always, Wayne, thank you very much, and
Okay.
thank you for your presentation.
Thank you.
Okay. Well, that concludes Group 2. We will resume back here at 1:30 for our third and final group for the Shawnee County budget. So I want to thank everybody for being here. We're in recess till 1:30.